Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 22nd, 2025. This video is on a New England Journal of Medicine article published online yesterday, November 21st, 2025, titled Medical Management and Revascularization for Asymptomatic Carotid Stenosis. There was an accompanying editorial in the same issue of the journal. High grade, that is greater than 70% asymptomatic carotid stenosis, and the role of revascularization was evaluated. Improvements in stenting and endarterectomy and medical therapy challenged prior standards. The study investigators reported two parallel trials, one stenting versus medical therapy, and the second endarterectomy versus medical therapy. There were 1,245 individuals enrolled in the stenting trial and nearly the same number, 1,240, in the endarterectomy trial. Follow-up median period of 3.6 to 4 years. Primary outcome, stroke or death at 0 to 44 days, or ipsilateral ischemic stroke up to 4 years. The patients were managed with intensively, targeting an LDL of less than 70 milligrams per deciliter, a systolic blood pressure less than 130 millimeters of mercury, and lifestyle coaching. What did they find? In the stenting trial, the 4-year primary outcome was 6.0% versus 2.8% in the control group, p-value 0.02, favoring stenting. Endarterectomy trial, it was 5.3 versus 3.7%, p-value 0.24, no significant difference. Peri-procedural events were higher in revascularization arms. Limitations: changes in blood pressure and lipid targets have evolved over time. High operator expertise may limit generalizability. Key takeaways: stenting adds benefit over intensive medical management alone, and endarterectomy does not significantly reduce events versus medical therapy. Overall event rates are low with modern medical therapy. What did the editorialists say? Routine carotid endarterectomy no longer justified with modern medical therapy. That stenting showed benefit in CREST-2, but required expert operators and had fragile significance. Editorial concerns: benefit is small, 1 in 100 per year avoids stroke, and 1 in 100 harmed by the procedure. Majority of strokes and medical therapy alone were non-disabling. Medical therapy targets were not fully optimized to the new LDL goals of less than 55 milligrams per deciliter. And PCSK9 inhibitors may shift the balance. The editorials conclude: begin intensive medical therapy for all asymptomatic carotid stenosis, reserve revascularization for symptom development, or select patient preference. Clinical pearls: absolute benefit of stenting corresponds to a number needed to treat of 31 over 4 years. Risk factor optimization is crucial, including blood pressure and LDL targets. Endarterectomy offers no clear superiority over medical therapy in asymptomatic patients. Low rates of disabling stroke across all arms. Revascularization appropriate when symptoms of stenosis progression occurs. Hit pause and read these eponyms at your leisure. They're mentioned in this interesting New England Journal of Medicine article, and read both the editorial and the journal article. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.